everyone, welcome back to my channel Annaturelovers. Hope you all well. So today I am interested in a very worrying and alarming pathology for us women, and which kills more and more every year: breast cancer. First of all, I have just participated as every year in a race of Odyssea Paris 2017 for the fight against breast cancer. However, I did some researches to find out what this disease really is. Cancer is in general a disease characterized by the uncontrolled proliferation of abnormal cells. So, breast cancer also is a disease characterized by the presence of abnormal cells that multiply uncontrollably in the breast. Subsequently, these abnormal cells can spread in the body through the blood and lymphatic vessels, and this can take several years. It is the most diagnosed cancer in women worldwide, affect 1 in 9, and 1 in 27 dies, and the ages group is between 35 and 65. Physiologically, the breast is composed of fat, glands, and canals. The glands will produce milk, and the canals that are also called the galactophores will lead this milk to the nipples. There are two breast cancers. The first type called non-infiltrating or non-invasive cancers. In this case, the tumor concerns only the lobules and the canals and has not yet spread to the tissue surrounding these canals. Concerning canals, we have what we call the in situ ductal carcinoma, which is the most common non-infiltrating cancer forms inside the breast lactation canals. Concerning lobules, we have what we call the in situ lobular carcinoma, which affect the mammary lobules, and this type is a little rare. When they are detected very early, these cancers do not disseminate most often, and their treatment results in a cure. But if they are not treated, they continue to grow and become what we call infiltrating cancers. In this case, the disease invades the tissues around the lactation canals while remaining inside the breast. If not treated, the tumor can generate what we call metastases and spread to other parts of the body. Some of us try to understand the reasons of occurrence of cancer. There are studies that have identified certain factors such as genes. For example, if a person in your family had it before, this represents 5 to 10% of the cases. We must know that breast cancer is a hormone-dependent cancer. Therefore, earlier puberty or late menopause may increase the risk due to the high level of estrogen. So, how to detect breast cancer? Symptoms are not visible in general, but can be detected by palpating the breast. If you see a bump that is not necessarily painful, or the nipples retracts inward, if you see abnormal flows, or the breast changes shape or size, as soon as we see the appearance of these signs, we must go to see a doctor to make a first diagnosis and a mammogram to confirm all this, if you have breast cancer or not. We must not confuse the sign of pregnancy or a menstrual cycle with the sign of breast cancer, because they are more or less similar. The treatment of the breast cancer depends on the type of cancer you have and the stage of evolution. Often, surgery is the first treatment undertaken to remove the cancerous tumor. It is called a mastectomy. One can withdraw either a part or the whole. If only a part of the breast, I mean partial mastectomy, is removed, it's necessary to perform radiotherapy to destroy the remaining cancerous cells and reduce the risk of recurrence of a tumor. After we have chemotherapy, I'm not okay of this treatment because, as we know, chemical product is ingested in the body while there are natural solutions to cure. This involves using the anti-neoplastic drugs that are administered after surgery. Chemotherapy can destroy cancer cells of the tumor that would spread in the rest of the body. Among other therapy, hormone therapy with anti-estrogen is found. If a woman has infiltrating cancer, a drug is administered by intravenous injection.
As the days go by, like the four seasons of our lives, I still see birds that fly, like teardrops on my face. I remember yesterday, we sat on the bench where you called my name. As the days go by, as the days go by.
There is an important link between physical activity, health and well-being. Many studies show that sport and regular physical activity reduce the risk of breast cancer by 20 to 30%. Even for those who have already been affected by the disease, the sport increases their chance of survival, and it also improves the oxygenation and decreases the insulin levels. Running makes you happy, provides well-being. It allows you to forget your daily life by evacuating the stress, because as we know, stress is at the origin of many diseases that we suffer. So keep in mind that breast cancer is the first cancer in terms of frequency. Many advances have been made in recent years, from detection of the disease to management, during and after cancer. The frequency of mammograms has also increased because it allows the disease to be detected, which has led to a decrease in breast cancer mortality. So ladies, take care of yourself. Like I said earlier, stress promotes a large quantities of hormones such as adrenaline and cortisol, and their effect can disrupt our body. Have a rest when necessary and adopt a cool attitude. If you see something abnormal about your breast or around, do not wait. Go and see your doctor. Once again, do not forget that nature has given us everything. So enjoy, ladies, and take care of your health. You are all beautiful and wonderful, and you deserve to be happy and to blossom. See you on my next one with an ocean of love. Take care. Bye-bye.